Hello everyone, my name is Dr. Payawandi. In this video, I want to talk about different type of masks and how to use them properly. There are many measures we can take to try to reduce the risk of transmissions of this COVID-19 to our local populations. The most important is social distancing, keeping your distance from your loved one or from people around you when you go shopping or go outside for any kind of activity, about 2 meters or 6 feet. Washing hands and disinfecting the surfaces or other measures. One of those measures, which is very important, is wearing mask. Even if you don't have any mask, any kind of fabric which you can use to cover your face and your nose to prevent the respiratory droplets transmission to people around you. So the mask, there are different type. This is the one which most people uses, including healthcare professionals, which is called surgical mask. This is also for healthcare providers and it's called N95. Obviously there are different type. The one which I have is 3M N95 here. The constructions, people also have different type of mask which contains respiratory filters, and here is one of the other masks which I have is P95. So this is the surgical mask. It contains of 3 layers. The outer layers, which absorbs, repels the respiratory droplets. Then we have the middle layers, which contains the filter, and the inner layers, which is soft and it absorbs the moisture. The materials usually either fabric, but most of the time they are polypropylenes, and these are a type of really plastic or thermoplastic polymers. That's what these are. To use them properly, obviously you do not want to touch your chin like this, which some people does, holding it like that. So you hold it from the slings and you go straight onto your nose and your mouth, and your sling behind your ears. Press on the edge here to seal it and pull it down, so it seals very nicely. Don't touch here, and if you do, wash your hands. To take it off, very easy. Just remove the slings and put them away. The N95 is the material is polypropylenes as well, which is a type of plastic really, and it has 4 layers. The outer layers, the second layers, which is made of usually cellulose or polyester, the third and the inner layers, which are different type of plastics called polypropylene. As you can see here, it also has this soft material which cushions on the nose, so it's not irritating the nose. These provide a very good sealing around the nose and the mouth, so it's very good, especially for healthcare providers. So you hold it there, the first slings goes on top, and then the second slings, and as you can see, it's very nicely sealed around the nose. And to remove it, just bring one slings back and then the second slings. Okay. The idea of these masks are obviously the respiratory droplets from the person who's wearing a mask will not be transmitted to other people, and hopefully prevent the transmissions of coronavirus as well. It's very important to wear them, especially in confined places such as grocery shop, doctor's office, dental offices. So it helps to reduce the transmission of this coronavirus. If you have any health questions, or if you have any concerns related to your health, you can give us a call for a consultation at 289-304-4666. Thank you for watching.